Hey everyone, I'm Dr. Owens with Carithers Pediatric group. So I'm here for another episode of Ask a Pediatrician. I wanted to use this episode as a chance to talk to you about one of my favorite subjects, that's constipation. And also being one of the younger physicians in the group, I wanted to use this as a chance to incorporate some of the ways that we communicate with our generation that's using hashtags. So constipation can mean different things at different times in your child's life, and there are times that when your child is more at risk of developing constipation. And so if you looked at the Rome criteria, constipation could include any time that your child has less than 3 bowel movements in a week or more than 1 episode of stooling accidents in a week. And then also it could be that if your child is having large diameter stools that can sometimes clog the toilet, or as I would say, hashtag, did that just come out of my child? Now, it's not uncommon for a nursing infant to go several days without a bowel movement, and this can still be normal. As long as there's no impact on feeding, it's normally not an issue. However, if your infant starts to develop firm, small stools, hashtag are those coffee beans, or if there's any change in color to red or white, then be sure to bring them in to let us evaluate and make sure there's no other issues. Like I said before, there are times in your child's life when they are at risk of developing constipation, and this can occur in infancy, around the time of introducing solid foods, or in early childhood, or around potty training, or when your child first goes to school. And it's important to know that as constipation worsens, your child may experience episodes of fecal incontinence during the day. And you should try not to get angry or punish your child if this occurs, because it's normally not a willful act and happens because of loss in sensation or overflow of stool as your colon is being stretched. Now, there are some simple things you can do at home to try to prevent or treat constipation. And these include encouraging your child to have a nice balanced diet, to sit on the potty for 10 minutes twice a day, preferably at the same time each day, or after meals to utilize something we call the gastrocolic reflex, or hashtag the Taco Bell effect. It's important to not place an expectation that your child has a bowel movement every time they sit, but use this as a time where they can have some quiet time reading a book or work on a puzzle. Hashtag do kids still do those? Now, if they do have a bowel movement, be sure to shower them with praise for positive reinforcement. And over time, your child will begin to develop a healthy bowel regimen and may find it's easier to go to the bathroom at these times. If these interventions still fail to result in your child having normal bowel movements, bring your child in so that we can determine the best course to get your child back on track. Thanks for listening to another episode of Ask a Pediatrician.